Thank you and welcome to Skin Clinic, our daily pop-up at 4 p.m. that we have every day to help people learn different tools, tricks, products that are available to help you take care of yourself while you're staying home and unveil a glowing, youthful glow underneath dead skin by promoting cell turnover and learning different at-home devices that can really help you step up your game and achieve the skin texture and overall dewiness and glow that you are always dreaming about. Today we have a really special guest who I'm going to bring in just 1 minute. Her name is Pat, and she is considered one of the best in the industry when you're considering Botox or dermal fillers. And I'm going to bring her on right now, and we have some questions for her. And then if you have any questions that you want to ask, then you can just add them through the chat. So we're going to bring her on now. All right, Pat. Hi, Pat. Oh, here. There we go. Hi, Pat.
Hi, how are you?
Doing really well, thank you. How are you?
Well, thank you. Day 11 of confinement.
Well, you look radiant as always.
Well, thank you.
Can you tell us a little bit about your background and how long you've been in the industry and what you currently do for a living?
Of course. So basically, I've been in the plastic surgery arena for over 30 years. I've worked with two primarily plastic surgeons in their office, both of them well known and respected here in Arizona. And then I've done a lot of outpatient surgery, all cosmetic also. And then in the last 15 years, I've done nothing but injectables, which means Botox, dermal fillers, that sort of thing. Some lasers, that's not my favorite thing. So the injectables are really my expertise. Mm-hmm. And I also train for Allergan and another country or another organization called Aesthetic Advancements Incorporated, and they're based out of Atlanta, Georgia. And so we go all over the United States and teach other injectors how to do exactly what I do safely.
Mm-hmm. Great. Well, and that's how I found out about you from one of my business self-care and gurus that I go to for all things in life, Nancy, and she told me that you're the best and the only person to go to. And then it come to find out many of my other friends and family also go to you. And one of my friends, she just went through medical school and was just telling me about how you're the sought after instructor for Allergan and teaching people how to do things right in this arena. So we're excited and very grateful that you took time to answer some questions for us today.
Oh, well, thank you. My pleasure.
So a couple of questions that, I think are kind of, just a 101 foundation of kind of wanting to understand the difference between Botox and filler and, what are the, advantages of each and considerations when you're exploring that. So could you kind of just break it down for us on just a fundamental level?
Absolutely. So Botox and fillers are totally different, and that is confusing to a lot of people. So Botox is really something that weakens the muscle temporarily so that you can effectively contract that muscle that forms the wrinkle. Fillers actually fill the wrinkle. So there's something that is made synthetically that volumizes the area. And it can be used for more than just wrinkles. Fillers are used for a variety of things, not just to fill a wrinkle, where Botox is used to basically stop the contraction and stop the wrinkling.
Got it.
So that's basically what it is.
Okay, got it. And so at what stage in life or skin changes that somebody might experience would they be candidates for either Botox or filler? And how do you kind of determine that?
Well, here's how I kind of look at it, especially with the younger generation, those girls that are between 20 and 30, it's really a luxury or preventative. So if they're going to use Botox, it's preventing those lines or those wrinkles from getting etched into the skin, because with continued contraction of that muscle, that's exactly what happens. Volumizing, the most common areas for women in that age group are lips or cheeks, because they certainly don't need their jawline defined. They don't need their brows lifted that much, that more than what Botox can lift it. So there's some specific areas that younger women like. When you're in your 30s to your 50s, it becomes more of a maintenance issue. You know, I think a perfect age for someone that looks really beautiful is around 40 to 45. It's a mature look. The angle of their face is beautiful. Everything looks smooth. You know, it's before the big 50, the big 50 starts to creep in on you. And so that's a good time to maintain your look. So you want to keep the Botox, or you want to keep the wrinkles at bay. You want to keep the volume, because the volume is what really makes you look youthful. And then when you get in your 50s or 60s, it becomes a necessity to maintain. So remember, you don't want to look different. You just want to look refreshed. So that's the whole goal, especially with somebody that is a more experienced injector. We don't want to change the way you look. We just want you to look better.
And brighter and fresher. Got
Exactly.
it.
Exactly.
How do you customize what we call a master plan? How do you customize that for, you know, determining when filler would, you know, Botox, and how long you're going to stay on that plan, and at what point would you explore things like filler or other enhancements, and kind of how do you map that out?
It's going to be an ongoing master plan, basically. So depending upon what your main concern is when you come in, and kind of a lot has to do with your age, because as we age, things happen. We lose volume from bone loss. We lose volume from our fat pads shrinking. The women that are the gym rats really show their age more, because that's where they lose their weight first, is in their face. And that's where it's aging, is in the face. So we don't want to get you guys too thinned out. I know everybody likes to exercise and keep fit, but you got to remember that if you're going to exercise and keep fit, we're going to be putting some filler in your face at a much younger age than if you didn't, or you weren't as you know, driven to be so thin.
So thin, yeah.
Exactly.
Well, and that's kind of a good reminder, because, you know, being really thin, it can be a desirable look for so many women. But it's an aspect that's kind of not talked about very much, and that is when you're undernourished or exercise too much, how it can age your face. And when you don't have any fat is when you can tell, and you can sometimes even look older than you actually are.
Oh, definitely. It skeletonizes your face. So it hollows out, and then you look much older. And that's a typical thing that happens as we age, because we do start looking hollowed out. But as a young woman, that's not what you want. So that's when we have to use fillers and or a combination of Botox or other treatments. Some people like fat injections. That's kind of the new thing that a surgeon can do, which is great. But nothing is permanent. Even fat can be absorbed over a period of time, just like the fillers are degraded over a period of time. So it's really kind of an ongoing plan, as you kind of mentioned earlier. It also incorporates skincare, laser treatments, you know, ultimately surgery perhaps. So those are all things that as you sit down with your provider, you want to discuss.
Got it. Okay. I have a couple questions coming in, so we'll answer these.
Okay.
At age 63, I feel like I'm weathering well. Is there a different approach to consider when you're starting at that age? And I don't, maybe the question, maybe if they've not done anything yet?
Okay, I'm going to assume that they haven't done any surgery or major surgeries, maybe something minor. So if they need surgery, and surgery is out of the question, you know, for whatever reason, either medically or financially, then their best option is to do some resurfacing or smoothing the skin, because at that age we start to lose a lot of our collagen. So we need something to stimulate that. So that would be some lasers, in addition to the fillers and the Botox. So you've got a couple of issues that are going on and a couple of possibilities, and it's going to really depend upon how the patient presents when you see them. Some people, you know, may not need as much as others, and others may need a substantial amount.
She mentioned that she's looking to have fuller lips and have her mouth wrinkles gone. So what, is that more of a lip filler approach, or
Yes.
Botox too?
No, well, you can use both, but lip filler is going to be the best and the most dramatic change for her in that regard. If she wanted something on a more permanent base, she could certainly use fat or an implant. But filler is a nice way to achieve it. And the thing about filler in your lips, just let me say one thing here, Ashley. The girls don't realize that if you can't do filler and never do it again for a year in your lips, because if you let it totally degrade, you're starting from ground zero. The whole idea with doing filler in your lips is to augment it along the way, and that maintains your volume. So if you have your lip filler, say, one day, and then in 4 to 6 months, you have a little bit more, another 4 to 6 months, you have a little bit more, you're maintaining it so that it doesn't go back to zero and you start all over again. It keeps your lips nice and full.
And how do you avoid, I think this is one of the areas that can become kind of scary when you're on these topics, because we all know that look when it's so obvious that somebody's had their lips done and it's just not attractive. So what's your advice for creating a natural lip for somebody that was wanting to explore a way to have fuller lips and get rid of wrinkles?
It's kind of interesting when you start doing your lips, and I'm talking about the patient now. When you start doing your lips, you only want a little bit because you're nervous that they're going to look, just what you said, a little overdone. So you start with a little. Within a week or so, you come back and you go, I like that. Let's do a little bit more. Okay, a little bit more. And then you have to literally cut the patient off at a point where the lips look nice, they look proportionate to the face, and that's all you want to do, because if you go over that line, then it starts looking done and it doesn't look pretty. And it's a reflection on the injector too, because now we're letting the patient dictate what we know is appropriate. So you don't want to go to somebody that really truly won't say, no, I don't want to do that on you because I don't think it'll look nice.
I see. And how do you find that type of, well-respected, practitioner that really isn't going to do something that's going to change your face or overdo it?
Well, I think if you don't know somebody's doing injectables and they're talking and they're saying, oh yeah, I get injectables, that's the sign of whoever they go to is a good injector. They look natural. They don't look done. They don't look abnormal. They don't look disproportionate or anything like that. Word of mouth, looking at who they've done is always important. And truly, word of mouth is probably the best way, because there are a lot of good injectors, but there are a lot of bad ones too that kind of are more interested in just filling you to the rim and not really paying attention to aesthetics of the face.
I see. Well, that's good advice. We had another question. This was a woman that had emergency surgery and a revision and ended up with a recessed scar in her marionette area. For years, she used collagen that was constantly getting refilled. More recently, something else, and it lasted for 3 years. I'm not sure what it was. Are there any products that you recommend for scars in the injectable arena?
So there's a product, and it depends upon the severity of the defect, of course. So if she wants instant gratification, then it's going to be one of the fillers that's a hyaluronic acid, like Juvederm, Restylane products, those type of things. If she's willing to be patient, there's a product called Sculptra. Sculptra is a bioactivator, so it's not really a filler. It stimulates collagen growth. And depending upon the patient's age, that would dictate a lot of how well she responds to that, because the older we get, the less we produce collagen. So we want to make sure that she's below 80, let's say, because you stop really producing collagen in your 80s. So if she's young in that regard, she may be more of that patient appropriate for that particular filler. But there are other fillers out there that could be good too. You could, any of the hyaluronic acids would give her a good result.
Okay. And just to go back to the lips, what was the product that you recommend for lips when you're doing filler?
Okay, any of the hyaluronic acids.
For
so
your
there's
lips.
characteristics of each of the products. Those characteristics make them unique, and in some areas better than to use than in other areas. For the lips, there's several products that are on the market that are very appropriate. Galderma has 3 or 4. Allergan has 2 or 3 that are appropriate. So it depends upon longevity, the patient's expectations, what kind of volume they want, and sometimes the cost to the patient, because not all fillers are the same cost.
I see.
So sometimes you can just use, for your lips, in my opinion, I like Juvederm because it's very soft and pliable, and it volumizes better than some of the other products.
Okay. All right. That's helpful. Are there any negative long-term effects of Botox?
No, there's nothing, because Botox has been used for over 30 years very safely, especially in the recommended doses that's issued by the FDA. And we use it off label too, absolutely not had any problems with that. The only downside is that if you let it all go away, which it always does, because your body degrades that Botox or any neuromodulator, not just Botox, it goes back to the normal contraction rate, so it continues to cause that wrinkle to reform if you stop using it. That's the only downside.
Okay. And what are there downsides to filler or other injectables?
Same thing. So basically, your volume or your wrinkle that you filled, or you're volumizing your cheeks or your lips or whatever, they're going to go down because the filler will be degraded. It'll be reabsorbed by your body totally. And so they're going to look just like they did before you ever started. That's the only thing. You'll continue to age. And as you continue to age, you'll notice other changes taking place. But it's not because the filler or the Botox is not being used anymore.
Okay. Got it.
Okay.
And then if you go to a bad injector, let's say, or you have something that happens where it's considered a botched job, how do you fix it?
So if it's Botox, some things can be fixed and some things can't. That's the bad news. The good news is that it always goes away and will return to normal function. So it depends upon where they put it, the dosage they put it, what it caused, that sort of thing would determine whether you can adjust it or fix it or not. There's no antidote for Botox. Okay? There is for filler. There is stuff that will dissolve filler and takes it entirely out. Okay? You can sometimes take a little bit out if it's just like, I got a little bit too much on one area. You can dissolve a little bit, but most of the time it takes it all out. So that's the safety part of it. And all of the fillers can be dissolved, even radius.
Okay. All right. Well, that's good to know.
Yeah, it's a nice safety valve.
So if you go down the path of getting Botox or filler and then you decide you don't want it anymore, or something happens in your life where you just can't get it, what should you expect? I think what I heard you say is it'll just kind of go back to the way it was before. There's no other lingering after effects?
No, there really isn't. I mean, you just get, what's really interesting is that you get very, very used to the look of the filler or the look of the Botox, because it's very enhancing to the features, okay? So pretty soon you start thinking, oh my, I look old again. So then it encourages you to go back. But other than that, no, there's not any downside to it at all.
Okay. And you had touched on that, you know, Botox has other generic versions, and so I think I heard you
Yes.
say that you're comfortable using the generic versions.
Oh, okay, so Botox is a brand name
Okay.
by Allergan. Okay, there are 3 other neural nodulators on the market by different manufacturers. There's Xeomin, there's Dysport, probably the second most widely known, and then the new one, Nutox. So they're all basically the same medication, but they're manufactured very differently, and it makes their properties and their dosage different. They are not interchangeable, but they all work the same.
Okay.
So that's kind of important to realize that if you go in and you want one particular type of neural nodulator, that's fine. You may have a reason for wanting it. Maybe you think it works better for you, or maybe you like the look of it better. That's fine. So whoever you go to should be experienced in using all of them.
Okay.
Same thing with the fillers. You want somebody that uses all of them, knows the properties, knows what they'll do under the skin, so that they can choose the appropriate product for you.
Okay. One of the questions that just came in is, if you get your lips done and you decide to not go anymore, will they appear to be more deflated since they had stretched to get bigger?
Only if you've stretched them a lot, meaning that you kind of overfill them for a long period of time.
Okay. If you stay in the range of just a natural, modest amount, you should be fine in terms of going back to how they were before.
Yes, and there's certain products that don't just fill the lip. Some women will come in and they have really beautiful full lips like you, Ashley. Okay, you don't need any filler, but you might want to fill out the wrinkles, because as we get older, those wrinkles in our lip become more apparent. So there are products that are made specifically to fill the wrinkle, not volumize the lip.
Okay.
So that may be something that you have to differentiate when you see the patient and you're talking to them, and you have to understand exactly what they want. That's very important.
I see. Okay, and obviously right now we're talking about, you know, long range planning, or things that we would consider in our post-isolation world, because for most people right now, we're not going out and considering treatments like this. We're staying home. So
correct.
For a lot of people, I'm assuming that, you know, some of the concerns might be, if you've been getting these treatments done, is there anything you can do to prolong it while you're in isolation? For instance, Botox, which I think is the most common, is there anything to do to prolong it during this time, other than skincare?
Unfortunately,
no.
Botox always goes away, and it depends upon 2 things: the dosage that was used on you and your own metabolism. So if you have a high metabolism, it's going to go away. So if you're always in the gym, it's going to go away faster than if you're a couch potato. Okay. So I guess the answer is be a couch potato, right? And then your Botox will last longer until your fillers.
Good advice.
The other thing, Ashley, I can share with you is, at least our office is doing virtual consultations. So even if you've had Botox or fillers before and you have a question about them, we can certainly answer that without you coming into the office. Or if you want to see if you're an appropriate candidate, we can tell you, and we can give you a cost for those things. Yeah. So it's kind of nice for you to plan ahead, because if you're going to do fillers, there are certain things I wouldn't want you to take, like fish oil, flaxseed oil, aspirin or aspirin products, because they prolong bleeding time. And what that does is makes you more prone to bruising. So those are things that are kind of would be helpful to know before you come in, because once you get in the chair, you're like, yeah, I want to do it right now. And that's fine, but you don't want to bruise a lot either. Yeah. So just kind of preparing for that future injection time.
We had one more question, and then we'll wrap it up. And there's a lot of gynecologists, dentists, and other types of doctors that do Botox, that they're trained in it. what's your opinion on going to a licensed esthetician that's, specializes in injections versus a more of a general somebody that's generally practicing?
Well, estheticians in most states aren't even allowed to inject. They are in Arizona.
Oh.
If they're grandfathered in. Now, nurses can, and there is a movement across the United States that actually says only nurse practitioners and PAs can, or physicians can inject Botox and Botox and fillers. In Arizona, that's not true, and there's still some states that it's not true, but it's very important that you go to somebody that has the proper education, has someone that is knowledgeable with complications and how to take care of them. That's one of the major things, because everybody can have a problem. Even the best injectors in the world, you can see they've had problems. But if they don't know how to take care of it and fix it, that's a big issue. So you want to question that person that you're going to. You want to know their experience. You want to know what they would do if something happened. You want to know who their medical director is, if you ever have to deal with him or her, the physician. Those are things that are important to know.
Okay, well, that's all really helpful. We're getting messages from a lot of people that are interested in the virtual consultation. So Pat works for Paradise Valley Skin Clinic, and that's clinic with a K, K-L-I-N-I-C. And would they call just the front office to schedule it?
They can, or they can go on the website.
Okay.
It's ShapiroPlasticSurgery.com.
Okay.
And there'll be a place to schedule a virtual consultation. They just follow the instructions. It's really easy.
Okay. Well, that's helpful to know. Are there any other questions that anybody would like? You can unmute yourself if you want, or type them on the chat. I don't see any more. Well, Pat, thank you so much. This was really helpful, and it's just good information for people to understand as you're thinking about long-range planning for your beauty. And, we wish you well and hope you have a good time at home, and we'll look forward to seeing you when all this is over.
Oh, amen to that one. Thank you very much, Ashley. You guys stay beautiful.
Thank you. Bye,
Bye-bye.
Pat. Bye. All right, guys. Well, there we go. I hope that was helpful. We'll link Pat's information if you're interested in any virtual consultations. We look forward to. Oh, I'm not sure what just happened. Hold on. Hold on. Oh, there. Sorry, my screen. When she hung up, the screen went away. But we will link her information in our follow-up email. We're really excited for tomorrow. Tune in because we're going to revisit the basics of the daily dose, things that you should be doing for your skin every day. We've reviewed a lot of information over the last 2 weeks and know that it's a lot to take in, especially if some of these concepts are new to you. So we really just want to boil it down to the basics and make sure that the basis of a morning routine and a PM routine and the things that you want to include are covered and that we all fully understand that. So we'll be demonstrating, the products that we use in the morning and afternoon. We all like different products. Sorry, I have a lot of noise. We all like different products. So you got to kind of figure out which ones work best for you. We are just going to share our experience with the most effective medical grade products that our research has shown that the market currently has. And we'll be doing step-by-step guidance on the little things to include. Anything else, Wendy, that I should mention?
No, I think that was great. And I love today, the Botox and all those plastic surgery, all that stuff is stuff that people are so afraid to talk about. But yeah. I, for one, you guys can go back and watch our original YouTube when I talked about my initial time getting into my skin journey. And then in my 30s, I had an experience of a cousin telling me I needed Botox because I had this weird I thought it was a scar, but it was a wrinkle line, a frown line. And I had always said, I will never do that. I would never do that. And this was way before it was more mainstream, but doing that is like, I'm so grateful for it. And I think that talking about it is just such a weird thing, but I for one, I've done stuff to my body and to my face. And I'll tell you, whatever we can do to boost our confidence, to make us feel fresh, we should be doing it. And we should be totally cool with talking about it.
Yeah.
Yeah. Because, it's all about, listen,
how you feel.
Yeah, it's all about how you feel. And so I'm really excited about this topic, and I love Pat, and I do think it's important to go to someone who really knows what they're doing, because kind of the whole point of today and having a master plan is you always want to start with the end in mind. And so it's always thinking about how I want to look today, but also what does that look like 5 years, 10 years, 15, 20 years from now? And you have to go to someone that's real clear about what they do today and what it's going to end up like in the future. So I'm really grateful to have Pat on today and have access to someone with such expertise. And last thing I'll say that I loved about her, and anyone I've ever met with in the plastic surgery world or in the facial world, the second they tell me they won't do something, I'm like, okay, you're my person. You're my person, because you'll tell me no. And so that's who I know I need to go to, because they're not hungry to just do stuff.
Yeah, exactly.
Right. Yeah.
I think just popping into a place or doing something like that on a whim is something you should always steer away from. And again, light, natural, little enhancements. My sister likes to call it baby Botox. Little steps along the way are great preventatives from not allowing wrinkles to get deeper. And later in life, when you already have wrinkles formed, that's when you can start exploring some of the other, filler options. If that suits you. We're not saying that's the only way, but for some people, you want the extra help, and this is a way to explore it.
Yeah.
All right, guys. Well, thank you. Sorry we went a little over. We'll look forward to seeing you tomorrow, and stay in touch with our giveaways. All the information is on Instagram.
Okay. Bye. You guys. Thanks.
Bye.